This is an ultrasound study of a 34 years old female. She has come with the complaint of menorrhagia into 6 months, is married, has 1 kid. No history of present surgical intervention of any sort. And this is the uterus. She cannot hold the urine. It's very tender in the pelvic organ, in the region of the pelvic organ. She is tender to the probe. So this is the only urine that we can see in the urinary bladder is not full. So we'll have to do it because she is in quite agony. Well, this is the fibroid getting to the posterior wall of the uterus, measuring approximately 4.7 into 4.9 centimeters. And if you concentrate now, I wish I can get the endometrial canal, and you will see that the endometrial canal is this is the endometrial canal, this area, and this is the region of the fibroid. Okay, I will mark it so that it becomes more clear. Now this is the fibroid, and this is the endometrial canal. So it is quite adjacent to the endometrial canal with small space between these two regions. So this is the fibroid, worldly appearance, and this is the clear central endometrial canal. This is the anterior myometrium, this is the frontal region, and in this area, this is the fibroid. And then in this view, the endometrial canal is not clearly visualized. Whereas in the longitudinal section on the other side of the image, well, this is the uterus, and this area is the endometrial canal. So endometrial canal is free of any echoes or any other pathology. So this is the endometrial canal, is in very early proliferative phase. This is also the endometrial canal shadow at the lower segment of the uterus. So this is the endometrial canal, this is the fibroid, sorry, the F denotes fibroid. This is also the same fibroid, and this okay. So up to here, you can say we saw fibroid that is heterogeneous in appearance with no internal calcification, and proliferative phase endometrial canal, and the fibroid is seen sparing the endometrial canal in a way, no mass effect. All pressure effect is obvious on the endometrial canal. The myometrium is anterior myometrium, and the fundal region myometrium are normal in appearance. Now let's see that again the same in the gain. This is the longitudinal section of the uterus, and you can see the endometrial canal. Okay, fine enough. Now when I move the probe, apart from this pathology, that of the fibroid in the uterus, towards the right adnexal, I see a large pocket of fluid. Here it is. Contains, rather it is full of echoes. The cystic area is seen. This is a cystic area, Now if I just take this view, then this is the endometrial canal, this is the fundal part of the uterus is visualized, and this is the cystic area full of echoes seen in the region of the right adnexa, measuring approximately 6 by 4 centimeters. So echo-filled cyst. And this is most probably a hemorrhagic ovarian cyst in the region of the right adnexa. Here I see it here, separate from the ovary, uterus, sorry. Now you see that it is it has a thick wall around it. Now I am giving a sweep to the probe to see if it changes its shape. Now it retains its shape, and this area is representative of the wall of the cystic area. No calcium measures 4.3 millimeters. Now there is no internal calcification, no septa, and no solid element is visualized in this cystic area. This is the cyst with internal echoes. What is the volume of the cyst? Now this is the transverse section. Okay. The volume of the cyst is approximately 32 ml. So one of the pathologies is a fibroid. There it is. This is the fibroid in the posterior wall of the uterus. This is the endometrial canal. This is the uterus. This is the anterior wall of the uterus. This is the fundus of the uterus, and adjacent to the uterus and separate from it. Can we separate the cystic area from it? And the patient is extremely tender to the probe in this region. It's not easy to separate this cystic area from the posterior wall of the uterus. As you see that this is the posterior wall of the uterus, where the fibroid is, and despite every effort, it's very difficult to separate the cystic area from the posterior wall of the uterus. Not get here. In this location, I do get the lateral wall of the cystic area. This is the lateral wall of the cystic area, and this is the interior wall. You can see posterior wall at first thick enhancement, and this is the second. So this is a separate cyst, and now few calculi are seen in the dependent region of the cystic area in the region of the right adnexa. This is either a tubo-ovarian cystic mass, pyrosalpinx, or hemorrhagic cyst. it's difficult to give the differential without any lab or gynecological examination. So now when I move the probe further upwards, what comes into the view is fluid. Here you see there is fluid in the peritoneal cavity. This is fluid. These are bowels. Here I have magnified to show you the fluid and the echo-filled area separately. So this is the fluid in the peritoneal cavity, clearly seen. This is black area is representative of fluid in the peritoneal cavity with bowel segments seen in it. This is the fluid. Again, this is the fluid. This is the fluid. This is the cystic area. Right biosalpings or hemorrhagic ovarian cyst, any one of these two. And this fluid may very well be representative of rupture of this cyst or torsion of this ovarian cyst, if this is an ovarian cyst. Hemorrhagic ovarian cyst, as the patient is very tender, painful in this region, and these are the bowel segments seen, part of the mesentery is seen. It's a complicated pathology, no doubt. Without any lab profile, without any gynecological examination notes, the sonologist is really in a testing position, is put into testing position rather. That's where he is. Now this is in fact a magnified view. See that this is the endometrial canal, and now from this view it's difficult to separate this fibroid from the posterior uterine wall of the endometrial canal. So the possible cause of menorrhagia that is lasting, as per the patient, that she has amenorrhea for the last 6 months. Here we are. So there seems to be something adjacent to each other. This is the anterior myometrium, endometrial canal. This is the fibroid. This is the fibroid. This is the endometrial canal. So the cause of the menorrhagia is this fibroid and the so adjacent endometrial canal. Whereas this is the present pathology that she has developed in the form of a cystic area, tubular extending from the uterus, right corner, and then extending to the region of the right adnexal. This is the cystic area. The tubular in this view measures 6.5 into 3.4 centimeters. This is a cystic area full of echoes.